reason, but we do grieve. There's different ways to deal with that grief, and Heidi will be here to teach us about them. So let's get started. Tricia Fuller, she is an award-winning master hypnotist, an NPL, neuro-linguistic programming trainer and practitioner. She's a mentor, an international and TEDx speaker. Tricia is a successful business owner, overseeing multiple clinic locations and a vocational school. Her teaching background includes years of instructing first aid with and CPR with the Red Cross, of course, the Canadian Red Cross, and the Heart and Stroke Foundation, as well as teaching hypnosis for childbirth with hypnobabies. I could have used that. Her hypnosis clinics, through her hypnosis clinics, Tricia has supported thousands of clients in achieving her goals. Her client successes have earned her multiple accolades, including 3-time Hypnotist of the Year at the Alberta and Canada Prestige Awards and Innovation and Excellence Awards, as well as some others. So Tricia, I am just going to hand it over to you. And if I accidentally call you Trish, that's because a very good friend of mine is named Trish. And so I'll sometimes make that kind of mistake, but I will try not to.
I appreciate that. I do prefer Trisha, but if it's a person that you truly liked, then it resonates. All right. Thank you so much, Linda and Louise. Thank you for having me. And thank you to the Calgary Neuropathy group for letting me share some secrets with you this afternoon. I'm going to just move to a screen share here, and hopefully it works. Please confirm, Linda or Louise, that my head is actually in the right position and that I'm not blocking the slides.
Yes,
okay. Good. Awesome. That would be lovely if my slides share. So in a world of where there's a pill for everything, pills are great, but can you tolerate the side effects? So most people find that, there's only negative side effects, and it kind of outweighs the pros of any given medication. So hypnosis happens to be, drug-free, has been used for thousands and thousands and thousands of years, and only has positive side effects. And there's very few things in this world where you can say that something absolutely only has positive side effects. And the range of success for any given modality, of course, you can have 0 to 180, but, any degree of change becomes very pertinent for people, especially when they begin looking at their change as how much more can I get each week or each day. So the original use of hypnosis, when I say it's literally been used for thousands of years, it's been documented back into when Egyptians used it in something called sleep temples or healing temples. And it literally is, the laying of hands and speaking over people. It's using words and language to facilitate the body's changes. And this becomes like super powerful. And then if you advance like thousands of years, you can go into what's called James Esdale era. And he was a surgeon, a field surgeon that utilized hypnosis for surgical procedures. He did over 300 pain-free surgeries. And, a lot of that had to do with why they wanted the pain relief. So hypnotic depth is directly dependent on need. And if a person really needs the relief, the hypnosis is able to be more effective. So the more a person wants it, the more benefit they receive. Hypnosis involves belief, imagination, conviction, and expectation. And we need to make sure that we actually are able to have that person believe in the modality far before, and I'll explain that in a little while. But James Esdale did over 300 surgeries pain-free, and the location that it happened at is also super important. So yes, it's on the battlefield, but it was also in India, where they have a higher belief system of something bigger than themselves, that they really do believe in other energies. So when he took his research back to England, he was debunked because they could not prove it. Which brings me to a very important part of hypnosis, that hypnosis is equally an art as well as a science. Um, Linda and Louise both asked me to provide like different links for sources and stuff, and I can provide those books. However, every time somebody puts on a white coat and tries to do hypnosis, the effects go down. So it really does have to do with the connection to the information. And if it seems overly analytical or scientific, the results go down because people don't resonate with things they like, where it becomes too super analytical. Hypnosis itself is the ability to focus on one thing to the exclusion of everything else. And what this really means is how well a person pay attention and follow directions. So what a lot of people do not understand when they come to a hypnotist is that they cannot have it done to them. All hypnosis, even if it's on stage, it's always self-hypnosis. All hypnosis is self-hypnosis. You are always in control. And, I'm not sure if you know this, but you've actually done it before. So hypnosis is a brainwave state. Right now you're in something called alpha brainwave, and it looks a lot like a heart monitor, and it goes up and down and up and down and up and down. And each peak and valley is like a different thought. Underneath that, we have alpha, which is prayer or meditation. Sorry, the first one was beta. I said that wrong. Beta is faster, quicker, and we're jumping from thought to thought to thought to thought. And then we have alpha, which is prayer or meditation. It is a little bit slower. It is a little bit wider. Okay. The state underneath that is theta. Theta is the brainwave state associated with hypnosis, and it is even slower and even wider. And the state below that is called delta, which is associated with sleep, slower and even wider. So every single day when you go down into sleep and when you come back out, you are going through a theta brainwave state. So you are absolutely in a hypnotic brainwave state at least twice a day. So if you think about this, and I can't actually see all the participants, but maybe just like shoot the comments in the chat. Who has driven somewhere, got there, and not remembered the last 5 minutes of the drive? Just a few people randomly comment if this has been something that you've experienced before. Perfect. So when we get to that destination, we did not black out. We did not lose control. We were just hyper focused on one thing to the exclusion of everything else, which means everything else kind of fell away. And that is what hypnosis is. It's a brainwave state with single thought. So James Braid had coined the term, and he was the first person to really just discover what hypnosis was. And he said he wished he never would have called it hypnosis, because hypno in Greek means sleep. And you're not asleep when you're in hypnosis. You are in a very focused brainwave state. Now, what he wished he would have called it was something called monoideism, which is singular thought. So if you have ever lost track of time while doing your favorite hobby, where time and space just kind of floats away and all of a sudden 4 or 6 or 8 hours has gone by and the time has just flown, that's a hypnotic state. When you've listened to somebody present on stage and you just really like resonate with what they're saying and you're so focused on it and the presentation just goes super quick, that's a hypnotic brainwave state. So everyday examples of hypnotists, daily hypnotists, are teachers, presenters, and doctors and nurses. So think of this when, especially before Dr. Google came along, you understand when a doctor said you have to do X, Y, and Z, people said, okay. They didn't even argue with it because they didn't have any resources to find out more information, or at least as many resources as we have now. Now people actually do change the conversation a little bit and they do a little bit more research. But people in a position of authority, we also have like people in law, people, policemen, anybody who is dictating to others automatically becomes what we call a natural hypnotist. Those are things happening all the time. So another example of hypnosis would be, let's see, and I hope this comes across on the audio. Where does this jingle come from? Ba-dum, bum, bum, bum. If somebody can put it in the chat, that would be awesome. I'll do it one more time. Ba-dum, bum, bum, bum. Does anybody know where that jingle comes from? McDonald's. And I'm a terrible, terrible singer, and somehow you still figured it out. So the thing is through relaxation, repetition, and fixation, we will never not know this. So if you think of, for instance, the ABC song, if you have an old school filing cabinet and you need to figure out where Q is in the alphabet, your brain automatically goes QRS, and it's an instant response. So the truth is that I am not actually hypnotizing people. I am dehypnotizing them from the world that they already have going on. And what we need to do is create a new hypnotic path. Okay. So this is not a magic wand. This is a skill that we learn through time. I'm guessing Linda has a question. So just let me finish this thought. This is a skill. So anything worth doing requires practice. So the first time you did tying your shoes took a little practice. First time you walked definitely took some practice. You know, lifting weights. Hypnosis is a muscle of your mind. So in order to create that muscle, we have to do the repetition portion, and I'll explain how we can do that later. So Linda, what's your question?
I was curious because you talked a lot about people having the ability to focus and follow direction, and how does it work for those of us with ADHD or even just ADD?
So the thing is, you know, I have a lot of people who come in and they say that they have ADHD or ADD or whatever they want to call it, that they cannot focus long enough. So one of the coolest tricks I can help them with is making sure they actually want to do this. So if a person's coming in and they're being told to do something, their motivation for focusing and paying attention goes way down because nobody likes to be dictated to. This has to be something the person actually desires. The second thing is I'll actually ask them some questions like, what is their favorite hobbies? Do you have any problems focusing on those things? And they will always, I'm not joking, 100% of the time, tell me they have zero problem paying attention to those things. Because if it interests you, you will pay attention. If it serves a purpose, you will pay attention. So if a person has the ability to be able to let go of pain, they're going to pay attention longer because this is something that actually serves them. Now, if I was talking about comic books, maybe their attention would wane. Or if, like for me, computer programming, like I'm as a womp. You know, it literally has to do with the desire to want to attain the information. But a cool trick that people can do with hypnosis that they don't know is in order to get the brain to pay attention, they could simply repeat the words as they hear it. So if the hypnotist or an audio or myself is telling a person to take a deep breath in, I would then have them say to themselves in their head, take a deep breath in, which begins the idea of all hypnosis is self-hypnosis. You have to choose to accept this suggestion. So all of a sudden, they become the magic hypnotist for themselves. Does that make sense?
It does. I know people with ADHD, they have that hyper focus, if you like. So they can really focus on the things they want to do and maybe not so much on the other things. Even though I know for myself, there are things that I want to do, but that might be a problem with procrastination actually, but
Well,
I do have
we can
trouble.
also work on procrastination and motivation. So the thing is, you know, you bring up, and I will reiterate this later in the process and how this works, is that I always offer a free screening to make sure that it resonates with the person, to make sure that they can focus and pay attention long enough to be able to utilize this skill. So there's ways to make sure that I would want to ensure that each client could actually do what I'm asking them to do. So I wouldn't I wouldn't take a client who couldn't. And there's very rare instances, less than 10% of the population, who I would actually refer out because they couldn't do hypnosis, if that makes sense. All right, moving onward. It'd be lovely if my screen worked. There we go. So we have 3 goals for hypnosis for pain relief. Of course, we would like to relieve the pain, reduce the pain, or change the sensation or move the sensation. There's many different tacks that we take. We don't just have one trick, one skill. We're learning a series of skills, and then people piece together the parts of the techniques that work best from them. We're also focusing on improving general health and sleep. So it becomes super important that if a person isn't getting enough rest, or if they're not actually hitting all of the parts of their health, then of course the pain is going to be more intense. And then we have to work diligently with reducing the stress, reducing fear associated with pain and or procedures, anxiety and depression. So lifting mood and creating a whole effect of general health. And the truth is if we improve on any one of these 3 things, then it becomes way more profound. So I hope you can see all of this. I see the bottom is a little bit cut off. So there's something called the fear. Oh, and it really changed this how. Oh, that's interesting. But anyways, the word is not like that on my screen. This is the first time I've ever seen it expand the word tension that way. But the fear, tension, pain syndrome was kind of first noticed in in childbirth. So people would begin to worry about the pain of how children come into the world, and they would increase their pain levels. This is the same thing that happens for people in any situation where they have potential for pain. So, in obstetrics and dentistry, surgery, oncology, neuropathy, we're always trying to mitigate this cycle of fear. So we go from fear to tension, and my apologies, I have no idea why it's messed up the format of that slide, but the tension, so it happens from the anticipation, so muscle rigidity, decreased movement, causing atrophy. And then we're not moving, we're not taking care of our bodies. And then we have more exhaustion, poor sleep, and it just increases the pain again. And then it becomes anger and depression and stress. So we're trying to solve all of these all the times. This slide's working a little bit better. So the goal is to change, alleviate, reduce, or eliminate any point in the cycle. And if you change just one point, the ripple effect can become profound. It can spread into others. And remember that I said that this is a skill. This is a skill like learning a new instrument. This is a skill like lifting weights. We have to continue to do the skill, to build that muscle of our mind so that it can become super potent. So when I work with people for any kind of disease, illness, or pain relief, there's things that you do want to absolutely remember. Number one, I absolutely needed a signed doctor's referral. Now, this isn't that I'm asking permission from the physician. It is that I am making sure that the person is medically cleared in order to reduce the pain. So an example of this would be if a person came to me with a stomach ache and I removed the pain, but they actually had acute appendicitis and they had a ruptured appendix, they could potentially die. So I need to make sure that the person is actually medically cleared, that we are allowed to reduce the pain in order to make their life better. And so having your physician, your doctor know that you're actually working on this. And it could be that you're working on your mental health. It could be that you're working on your pain relief. Both require me making sure that the physician knows what you are doing, that you are working on these. I would like to just briefly discuss like how to mitigate or rather temper expectations for people. Some people will come in and on their very first session, they will literally achieve, and I'm not exaggerating, like an 80% reduction. It doesn't happen every time. Sometimes a person will achieve 50%. Sometimes a person will achieve 10%. Remember that any degree of change, even if it's just that they actually felt rested, because remember I said that hypnosis is the state right above sleep. So if a person is in hypnosis, they're actually getting a deeper rest than they would get in a waking state. So they could feel more energy. They could feel maybe rejuvenated so that they can tackle some of their tasks. But there's a huge scope of success. And remember that, like I said, it's a muscle. Each time we do it, it can become stronger. And eventually the goal for all clients is that they would achieve the ability to do self-hypnosis to themselves. So I'd actually educate them how to utilize the techniques in the moment for themselves, wherever they may be, so that they don't require an audio, so they don't require a hypnotist to help them. But we want to empower people to be able to take action, to actually make the changes in their world with changing their mind. So don't think about a dog. Good luck with that. Lynn, did you have another question before I go forward?
I did. Just what you were talking about, the rest, you get more rest in hypnosis, say, than in sleep.
Yes.
That sort of tweaked me onto yoga nidra, because that's sort of the same thing they say about yoga nidra as well. Now,
Yes.
I always end up falling asleep when I try to do yoga nidra, so I'm not sure if I'm getting the benefit, but
But
I just find it
actually,
interesting.
I would say that you absolutely are getting the benefit, because if it promotes you to rest, you will heal, you will rejuvenate, you will have more energy. So there's no way to do hypnosis wrong. There's no way to do yoga nidra wrong. The truth is yoga nidra is a very meditative state, and meditation and theta, so alpha brainwave and theta brainwave, are very closely linked, and people will go drip down into one and then all the way down into delta, and they will go up and down. But the point is that they're not in beta anymore, which means that, the hyper state, they're slowing down their nervous system, and rest can actually begin to take action. Cool. All right, so now we're going to go back to the very cute puppy. Don't think about a dog. So your mind cannot process negatives, but we use the word don't all the time. Don't stress, don't worry, I don't want pain. These things are literally direct suggestions to your subconscious mind. Your mind is always listening, but it cannot process the don't. So even if it's just that you're crossing out that dog in your mind, you still had to think of the dog in order to cross it out. So, an example with a weight loss client, I would say, don't think about broccoli. Well, that's a double negative. It works in their favor, because if I say broccoli 10 times, all of a sudden that becomes an embedded suggestion. So even when people study what they have happened to them, it becomes embedded suggestions. It's called the nocebo effect. So we've heard of the placebo effect, where if you hear something that is good, you can actually make it happen. Or if you're given a magic pill, this pill is going to fix what ails you. They've literally proven, specifically with anxiety and antidepressants, 50% of the time, those people, because they've been presented with that pill, will actually achieve greater results. So what the mind can do is profound. But what a lot of people do when they begin to experience any kind of disease discourse, symptoms of any kind, or even when they get a diagnosis, they will often research what that diagnosis is, and that nocebo effect becomes very potent. And whatever the mind reads, sees, hears, it becomes direct suggestion. So knowing that we have to begin to shift our thinking, shift our internal thoughts, and this is also where hypnosis comes in, is that we change the self-suggestions that we're giving ourselves. So it is exactly like going to a restaurant and placing an order. When you go to the restaurant, you say, you don't say, I don't want pizza and I don't want pasta and I don't want, French fries. You tell them actually what you want. Maybe I want a steak with the side salad or whatever that might be, but you have to state what you want. Another way of looking this would be like using Google Maps or like any kind of map device. So what happens is most people come in, and if we use the analogy that you are a map, you are a blue dot swirling around on the screen. There's no destination put in place. And so our goal with hypnosis is to help you set that destination. What do you want? Not what you want to get rid of, but what do you want? So let's just pretend that because this, you guys are, the association is in Calgary, we're going to pretend for a moment that you want to go to Edmonton. Edmonton's your destination. You'd actually have to put Edmonton in the destination. Once you have Edmonton in the destination, it auto-populates at least 3 routes of how to get there. Now, what it is doing, it is reverse engineering from the outcome backward. And even if you get halfway to Edmonton and you hit a detour or you get a flat tire or you have transmission problem, it doesn't change the destination. It just auto-corrects the route. So it begins with the end in mind, to quote Stephen Duchovny. But you always want to reverse engineer from what you want backwards. And that is the structure of genius. And that we can begin to really utilize what words do with that. So word connotation is super important. So what a word means to somebody will change their chemical state in their brain, which will change their mood and will change the effects on the body. So yes, we are a mind body. It's not one and then the other. It just, it ripples infinitely through each and every part. So we have to change word connotations to control comfort. So here's some examples. And actually, I'm just going to go back for 1 second. And even though I can't see you, humor me, say pain 10 times to yourself out loud. And I'm going to do it so that you have to hear it. But ideally do this with me. I can't see you guys doing that, but I would follow along. So pain, 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 pain. So I am fairly healthy. However, I am highly suggestible. And if I say the word pain 10 times to myself, especially with the weather today, I really do begin to feel like a pressure and an ache in my head. I also automatically notice that my shoulder today perhaps could use an adjustment. But pain intensifies the problem. The brain begins to go, oh, where is the pain? And it magnifies almost instantly because there is zero positive connotation to the word pain. Okay. Now, don't get me wrong. I'm not asking you guys to be fluffy and delusional about what you can accomplish. I'm saying there's got to be a better word to describe it so that your body actually feels better. So here are some of the words that I usually have to deal with when it comes to mind, making your mind feel healthier, happier, body feel better. And the first one is hard. And if you think about it, there's no time where somebody is told that something is hard where they feel better. Your subconscious mind is somewhere between the age of 5 to 7 years old. So if you imagine, and don't get me wrong, mine is no older, nobody's is, that's just our subconscious mind. It's our yes part of our mind. If you told a 5-year-old, that something was going to be hard, it's almost like they give up before they've even begun. They might as well just flop down on the ground and like, oh, I don't want to, but I've had, at least a dozen clients over the 14 years where if I use the word challenge, it's almost like their brain lights up. I had one lady say to me, and this was last year, she's like, you know what? When I hear the word challenge, it's like challenge accepted. Like I've got to do it. She can't hardly not do it as soon as that word challenge is put in there. And if you utilize the word challenge, and I offer you the opportunity to explore other words. Like if these words don't resonate with you, I'm just merely showing some words that people really have liked. So if you can change the word, instead of making something hard, if it's just a challenge, it becomes something that you can rise from. It becomes a solution. It becomes something that you can actually attain. Sick versus healing. Most people will come to me and they will say, I have X, Y, and Z. And I don't want to state anything right now because I don't actually want to embed that suggestion. But it's like they're owning it. They're holding on to whatever they have. Anytime you say I am or I have, it becomes something that your brain is holding on to and it doesn't want to let it go. So the question becomes, how can I make that statement better while owning what I have, or, being honest with people about what I'm experiencing? So sick versus healing. There's a great statement, and I wouldn't call them affirmations. Okay. I really do call these direct suggestions, and suggestions actually make a picture, a visual, an auditory, a kinesthetic feeling in the body. They're more than just like I am statements, but a really cool I am statement is I am healing. Now this becomes a twofold statement. Not only is the person healing from something, they are also saying that they are a healer. So you could be in the presence of the other person and say, I am healing, and you're providing that comfort to somebody else, which I have found for many people who have learned that just that simple statement, I am healing, that they actually, they emotionally have that a deeper empathy with the person that they're connecting with, and they actually find that those people feel better. Linda, question.
More of just a statement. I absolutely love this because a lot of what you're saying is something that we also say in our presentation out to the community. Only you have it much more robust and I think more like when Sylvia talks about this, she talks about neuropeptides being released in the brain, and that thought that you just had about it being hard, that gets wired in, sort of thing. Whereas if you change that word, so it's like the very same concepts, which gives me hope that it's getting out there. Those messages are out there now, and we just need people to hear them.
Right. I'm going to take it one step further. So the thing is like I said, hypnosis is relaxation, repetition, and fixation. So think of media. If you've heard a commercial one time, you may not resonate with it entirely. 7 times, it's starting to get stuck in your head. Maybe 100 times, it's hard to even notice that you don't believe it anymore. This happens all the time. With repetition of the same amount of information, we begin to believe it. Not that I think that Hitler was a powerful, a good person. He said, give me a child until they're 7, and he would indoctrinate the information over and over and over and over again. But use that technology to your benefit. If you began to tell yourself, I am healing, I am healing, I am healing, and what if you did say it 100 times? Your brain might go, huh, I am healing? And even if it's a question, it becomes more congruent in the nervous system. We've done this experiment. We did this with a group of, it was called Girls on Fire. And I stood up and I made them stand up and I made them say, I am happy and I am confident 10 times out loud. Now, they all started like with their heads down and they were all very sad. But by the end, they actually began to believe what they were saying. So thoughts, verbal and internal, become direct suggestions. So we do have to be super cautious about what we're saying because it becomes how we live.
And I just want to clarify for some people, because it took me quite a while to make the distinction. When you're talking about the nervous system, you're talking about the brain and how it's processing the pain that your peripheral nerves are giving you. You're not necessarily changing your peripheral nerves, but you're changing how your brain is processing that information coming in from those damaged nerves. And so it turns down that volume on the pain or the stress or
Yep.
whatever it is you're working on. And that's that's where the benefit lies.
Yeah, and it actually becomes magic. This is where the mental magic really begins, because if you begin, even if you don't believe it in the moment, the more you state it to yourself outside, out loud, or in your head, it becomes more automatic and the nervous system begins to believe it. So then people will talk to me about, well, how do we change words that there's really not a better word for? And stress is one of them. Same with anxiety. There's just no good connotation to those words. Same with pain. And I'll talk about that one in a minute. But what if you just changed the root word? So notice that I said I have less than calm written there. So the thing is again, just like, don't think about the dog. The brain hears just the calm. It doesn't hear the less. So you can even think about this, like if you're having we'll call it a bad day, which I rarely will ever say that. I will say I'm having a suboptimal day. Why? Because the root word is optimal. It's what I want. I'm trying to embed the suggestion of what I want, not what I want to get rid of. So I'm being completely honest. I didn't have a great day. I had a suboptimal day, or less than perfect, right? So notice how if we flip some of these words, we're still being honest. We can have that legitimate conversation with people about exactly what we're feeling, but we're actually changing our brain chemistry so that we actually begin feeling better in the moment. And that, that really has to do with the word pain versus discomfort. And again, pain, there is zero good. Oh, yeah, Linda, I better stop.
Oh, I saw a comment from Krista. I have trouble saying I'm healing if medically I'm not, which for peripheral neuropathy, you're probably not. There's just such a disconnect there for her.
Absolutely. You have to do things that resonate with you, but I'm curious, even if you don't, remember I said, if you don't believe it, what if you had a challenge for a whole week, every day, to say, I am healing? Now, the thing is people have achieved healing from many things, many. There's hundreds of thousands of documented cases where people have been cured from metastatic cancer. They've been cured from many different things. So if we can believe that one person has actually healed, we could begin to infer that we ourselves could heal. So I will offer this as a challenge to people. Even if you don't believe it, what if you said it 100 times for 7 days? Is there a possibility that by the end of that week, you could begin to slightly believe that there's a possibility, right? And remember, healing could be any number of things. What if we just had the sensations turned down? That is a form of healing. What if our mental health began to feel better? That is a form of healing.
So a person could, even if healing doesn't work for them because they know they're not healing, they could be saying things like, I'm turning down the volume on that pain. I can turn down the volume. If I keep doing this, I can turn down the volume.
Right. And the thing is this is why people go for like snake oils and like magical treatments. Like they're having that sense of hope. What if there is hope for healing? So even if we can just inspire hope for a better life, that is a form of healing. So again, we're just playing with it, like to see how it clicks for her a little bit better. But this is something worthy of playing with, increasing a person's belief to have hope again, even if it's a hope in a different scope, does provide some relief. So I hope, Krista, that can resonate with you in a slightly different way. But even just changing, a few words, if you're not ready for healing yet, absolutely use some of the ideas that Linda said. I turned down that sensation. Or what if you could move it to a teeny tiny spot, right? That there's magical opportunities, but it has to begin with hope somewhere, right? Okay, cool. So pain, like I said, there's no good use for the word pain. Discomfort. Again, notice the root word is comfort. So a person, now, when we originally used to use this statement, there was actual studies. Now they have been, they're very hard to find now because again, as soon as people mess with the information, it changes. And the study was done a very long time ago, but they did do it in the pain relief wards where they were giving out pain management pills. And one nurse was allowed to say, rate your pain on a scale of 0 to 10. And the other nurse was allowed to say, rate your discomfort on a scale of 0 to 10. And the one who said, rate your discomfort, gave out less medication. So again, even if you don't believe a word, when you begin to hear it over and over and over again, the mind begins to process it differently. And that is a great example of it. So what would this look like if a person chose to do some hypnosis for pain relief or sleep or mood enhancement or stress relief? We would always begin with that free screening to see if a person is a good candidate. So that can be done in person or virtually online via Zoom. And it does not change the effectiveness of the techniques at all, whether it's in person or online. We want to help you learn what hypnosis is, actually do some what we call hypnotic suggestibility tests to make sure that you can actually do hypnosis. And then potentially see how you can design a program that's right for your time and your budget. The first session is beginning to relax your mind and body. We have to begin with the basics and through the daily practice. So I actually assign homework, hypnosis sessions that you do in the comfort of your home, never while driving. You do these and you lay back, relax, and close your eyes, and it is a muscle. And each time you experience it, it becomes stronger, you become more comfortable. And having the ability to do these hypnosis sessions by yourself really begins to help you know that you are the one doing the hypnosis to you. And I am only a facilitator. I am here to help you learn the skills, but all hypnosis is self-hypnosis. You're doing it to yourself. So then once we've laid the foundational work for hypnosis, then depending on which point is the more potent one, we begin with either pain relief or a sleep program or stress and mood improvement. And like the arrows show, they're interchangeable. Sometimes we'll do, 2 or 3 sessions for mood and stress, and then we'll go into pain, or sometimes we'll go pain relief first. It really just depends on the person. Every session, every program for every person is completely customized. Yes, there's tools that I use for everyone. However, when I use them and how I use them is different for everybody. So this is very much a customized program for each person and their specific needs. So is there any way to be able to view all the participants and perhaps to do this technique with them? Or Linda, Louise, which would it be better if I just had them take a picture of this and or if I just assume that they're going through it with me? How would you like me to do this technique with them?
I know I can allow people to talk. I don't know if I can bring them all forward or if they're even comfortable doing that.
Oh, okay, sounds good. So this is a pattern interrupt technique. So when a person feels like they cannot gain control and they need something in the now, this is a technique that I use with people to help them gain control. Now, people will use this with fears, with phobias. And remember, fear and pain, they're connected. So if a person needs to gain control, they're less than calm, they want to gain control, this is something they can use. So step 1, super simple. You're not deciding what you're thinking. Is it right, wrong, good, bad, or up or down? That's not the point. It is what am I thinking useful or is it unuseful? If it is unuseful, then we simply count backwards from 5 to 1. We go 5, 4, 3, 2, 1. This is a Mel Robbins technique braided with some other techniques together, but it stimulates the prefrontal cortex of the mind, helps us stop being trapped in it, And then I utilize water in almost all of my hypnosis sessions to begin to be hypnotic in every way possible. So if you have water handy, you would simply drink the water and you would say, I wash it away. Now, if you don't have it handy, you can still think, I wash it away. And eventually you can braid this technique into having a bath, having a shower, watching it rain, watching water go down the drain. But again, notice that I did not say I'm not thinking about the pain or I'm not thinking about the stress. I'm saying I simply wash it away, which is telling our brain what we want it to do. We want to let it go. So we wash it away. And then we do this next technique, and this technique is gold. Just do it and trust me, you will see a difference. There isn't a person who cannot make a change in their nervous system by doing this, because of something called physiology trumps emotion. So what we do with our body changes how we feel. So when we do the milking motion, and I'm going to move over just a little bit, we go open with one hand and close, and then open with the other hand and close. And we just keep on doing that. And what it is doing is something called bilateral brain stimulation. When you do that, your brain has to cross the corpus callosum, and it makes an actual change, and you cannot reproduce the fear, the phobia, the anxiety, the stress in the same way. And in fact, if a person just keeps on doing this, it will actually completely dissipate. And I've had people doing it for a whole meeting while they were nervous, or, before they go on stage, or especially when they're healing. They will just focus on doing this technique while doing step number 5. If we are not breathing properly, we are not perfusing the body properly, which causes all kinds of chemical changes. So while we're doing the milking motion, if you can continue to do the milking motion, we're just going to do 3 in a row here. You're going to take a deep breath in to the count of 4, hold to the count of 4, blow out through your mouth like you're blowing out a candle to the count of 4, and hold to the count of 4. And again, big breath in, blowing up your belly, not your chest and shoulders, pushing your belly out, hold to the count of 4, blow out to the count of 4, and hold to the count of 4. One more time, big breath in to the count of 4, blow out to the count of 4, hold to the count of 4. Excellent. So Linda, because I can see you, please humor me. Can you tell me what you experience when you do what I just demonstrated? Or if anybody else would like to share it, that would be great.
I have trouble with the holding my breath. I don't know why. So I get kind of lightheaded. But I did notice that I have a chronic pain that's always there down my butt into my leg. And I think it's partially distraction, but it's definitely less than it was before.
Right. Yeah, and you're absolutely right. It is a form of distraction, but the thing is, it's a form of distraction that helps get a purpose. And what you explained about the lightheaded is an actual sign that we're not breathing properly, which actually increases the pain and noradrenaline and epinephrine in the body. So we actually want to, and even if you just decrease it to 2 or 1, you can begin to increase your lung capacity so that you actually can oxygenate and make your body feel better. But what you're explaining, absolutely, I've seen many, many times. Mm-hmm. And remember, distractions are there for a purpose. If we braid them with other techniques until things can kick in, like medications or using a hypnotic technique, it's giving you the control so that you can chase something that will help you longer.
We are seeing some very positive comments here. It's Louise. Margot says, hold back, settle down. Laura, I felt calmed. This is very good. Good.
Excellent. All right. So, and let me get this working again. This is how to reach me. Or if you have more questions, I'm also offering a free hypnosis audio download for anybody who emails me, as well as the article that I wrote for that magazine, just so you can kind of have like a condensed version of this talk so that you can actually get the bullet points If you take a picture of that or use it in any way to get more information, I'm happy to assist you to discovering what this could look like for you. So again, there's a free audio, free stress relief audio, as well as an article that I would love to share. So please email and please say where you came from so that I know. And I will stop sharing the screen. Everybody's got it? And Linda, I believe you took a picture too, so you could share it if you need. Perfect.
I did.
There we go.
How do you compare hypnosis to meditation, or as some say, positive self-talk?
So it's an and. So hypnosis is actually the deepest state. So again, so here's the conscious level that we're at right now. Prayer and meditation is underneath. Theta, which is hypnosis, is underneath it. And it is a focused state. So remember that often with meditation, people are guided into a neutral or a calming state. With hypnosis, we're taking it to purpose, like creating the change, planting the seed of what you want to grow later.
And that's exactly what I heard from you, was that meditation is sort of at one level, and maybe somatic release or tapping or going maybe to a next level. But even hypnosis would be taking it even one step further or a few steps further.
Yeah, absolutely. And the truth is, there's no such thing as like a new technique. A lot of old wine in a new bottle, but the truth is even with myself, like I use NLP and hypnosis, but I'm also using self-suggestion. I'm also using like other multitude of techniques that I'm braiding together to create an outcome. And some people don't know this phrase, but like I'm throwing spaghetti at the wall and you're the wall, and I'm trying to find out what's going to stick. And if multiple pieces are required, then yay. But we're trying to find as many things as possible to help a person rather than just one technique.
Again, a lot of the same stuff we talk about, that you're an experiment with a test subject of one, and you've got to try different things, see what works for you, keep what works, toss some stuff away, or even just set it aside because it might work at a different time.
That's right.
But yeah,
Absolutely. I don't condemn or condone any one thing. The truth is, if it works for somebody, fantastic, and I'm just here to provide another alternative, something that can be an and or an or.
So Tricia, Michelle's saying this reminds me of the EMDR counseling she does, where she has to tap or move her feet back and forth while thinking of the situation.
Yes and no. So remember that I didn't do an actual hypnotic technique. I just braided a whole bunch of NLP techniques together. So again, neurolinguistic programming and EMDR aren't that different. It's just how we utilize the skills. So again, maybe just a different label on something, but I think she's absolutely correct. It is very similar. Sorry, I got distracted by the squirrel on the screen with the comment coming up. But yes, she is correct. Yes.
And a question about the app REVERI. Can you comment on that? Because this person canceled it. Not a good experience.
You know what? I can even speak to that one, because I started with, oh my gosh, the one I've been working my way through meditation apps, and Reverie was one that did not last with me either. I don't even think I got past the trial period, and I said, yeah, this one is not
absolutely.
So.
Like, and even for myself, if I'm using hypnotic downloads that is outside of the team that I work with, that sometimes things don't resonate. The truth is that's why I'm offering a free screening. So like I actually want to make a connection with people, and there's a real feedback mechanism that I'm talking about here. I'm not talking about an app that you would use. I'm talking about actual sessions where a person comes in there, they go, Tricia, this is what went well, and this is what I want to work on next, or this is where I still need some help, or can you guide me with, do you have information on this, right? So there's a feedback mechanism of give and take here of what do you need? And then I tell you different options, and we'll find at least 3 creative options that might work as well as or better than what you did before.
Or just typing something in.
So yes, absolutely. If you're going to use apps, I guess my recommendation would be always to make sure that you know the trial period. But remember that they are generic. They,
Yeah.
you know,
Yeah, it's not tailored specific to you. And they, they'll put all kinds of different stuff in these apps for different scenarios, say, but it's still, like you say, generic. It's not focused specifically for you.
yeah. So yes, I have audios that are generic. However, the live sessions are absolutely completely driven to what the person is in front of, like whether it's online or in person, like it's changing verbatim based on what I need them to hear at that moment, based on what they've told me.
Told you first, yeah. That
Yeah.
makes sense. So you have I'm assuming a lengthy discussion or 2 or 3 beforehand, and then you get into where they need to.
Yeah, I specifically ask them, what do you want? And then I help them design that for what they need to create in their mind.
Great. Fantastic presentation. Thanks, Krista, so much. I'm open to learning more for sure, she says.
Fantastic. So yes, email for that free hypnosis audio and the information. It's been a pleasure to be here today.
Thank you so much. I really enjoyed it. It was very
Likewise.
engaging.
Thank you.
And okay. Thanks, Louise, for all your help.
Dawn, question.
Okay.
Where are you located?
I have a physical location in Sherwood Park currently. Occasionally I will do group scenarios like this, but not occasionally. I do group scenarios in specific locations, so workshops for people. And I usually go to that location. So say if you are all in Calgary and you wanted, a workshop, then we do it on site. Generally speaking, a lot of people like connecting if they want to do it on Zoom. We definitely, like, I teach virtually online as well. So I can be anywhere, but I'm physically located in Sherwood Park now.
But you can do sessions with an individual over Zoom, right?
Absolutely.
Someone is saying they're
Vancouver for sure.
Oh,
Absolutely. Okay. I have lots of people I can connect with there and do stuff with. So for sure. Let me know where and when.
Okay, well, think about that one. Okay,
sure.
I know where you've got probably a schedule to keep, and so we're more than happy to let you go. I still have a list of questions from.
You can just send me an email. And
it's okay.
Or we can do a Zoom meet, and more of your answers can be answered. Thank you very much to both of you. Thank you to the group. Thanks. Have a fantastic day, and stay warm, stay focused on being healthier. And I hope this provides some comfort for you. Take care.
Thanks.
Bye.
Bye. If anybody has questions for me, I'm more than willing to stay on for a little bit. Oh, no, wait a minute. I got another meeting at 2:30. Yes, I do. Okay. Yeah, I have a meeting, so if I have time for a few questions, if anybody wants to, or if you want to come forward, I can let you come up. Okay. Hi, everybody. Hopefully I'll see some of you on June, whatever it is, June. Oh gosh. June 5th.